Welcome back to the Eye Health Docu class. Now I'd like you to meet Alan Tillotson, one of the world's most respected herbalists with over 40 years of experience helping people heal naturally. This information will help you to see how herbal medicine can enhance your eye health by improving circulation, reducing inflammation, and supporting healing from within. We'll also share the most advanced herbal formulas for conditions like macular degeneration, glaucoma, and diabetic retinopathy. You'll even see how herbal remedies can help eliminate gut issues, an overlooked root cause of serious eye problems. Enjoy this presentation with Alan Tillotson. Dr. Tillotson, thank you so much for joining us. Really appreciate it.
You are welcome.
I understand that you have a huge history in herbal medicine, but in terms of ophthalmology, the relationship, how did this all get connected for you?
Okay, well, I started learning herbal medicine back in the 1970s. I was traveling around the world. I got really sick, and I ended up in Kathmandu, Nepal, where an herbal medicine doctor named Vaidya Vajrachari in Kathmandu saved my life with herbal medicine. So I came back to Delaware, and I decided I was going to study this. I went back and did my master's in medical anthropology living in Nepal in the 1970s. Okay, when I came back to Delaware, I met my wife, who's Chinese. She was a professor of Chinese medicine. Her name is Funai Sheng, and her and I opened the first holistic health clinic in Delaware. I also studied Chinese martial arts, and I was teaching Tai Chi, and one of my students was a board-certified ophthalmologist, Dr. Robert Abel. And both of us started talking to each other and got interested in natural medicines for ophthalmology, which at that point did not exist very much. And Dr. Abel was a very interesting guy. He wrote one of the first books on natural medicine treatment in ophthalmology, the eye care revolution. And we just began working together, developing formulas and learning how the eye works and all of that, and basing and developing natural medicines for treating eye problems.
So, Dr. Tillotson, that really is as if it was meant to be in terms of your story and learning about herbal medicine and how important it is. But why don't we move on now and talk about macular degeneration? How exactly can herbal medicine help someone that might be dealing with this condition?
Dr. Abel calls macular degeneration starvation of the retina. That little phrase helps you to understand it. As people get older, your body ages, your hair gets gray, your skin gets drier, and the same thing happens to your eye. The amount of circulation to the back of the eye in elderly people can be down by 30 to 40% sometimes. Okay? And then what happens is that the eye is nourished by a little membrane on the back of your retina called the retinal pigment epithelium, the RPE, and that nourishment decreases if the blood supply decreases, and the membrane itself begins to shrink and become drier. And then it pulls away, reducing vision because the optic nerve fibers are not getting enough nourishment. So the primary treatment for macular degeneration is to restore the basic nutrients that are most important to that part of the retina, and also to improve circulation to the retina. Western medicine kind of figured this out a while back. They talked about vitamin A. That was one of the early things that they used to do. And then later on, they found out about the carotenoids called lutein, zeaxanthin, and mesozeaxanthin, which is a stereoisomer of lutein. And those three primary carotenoid pigments, they're actually pigments, feed the membrane on the back of the eye that feeds the retina. So a lot of eye medicines you find on the market contain those three things. Now, what's very important to know, some of them only contain just lutein, and the better ones contain the other two. They have to be in the proper ratio to properly work, and that's the primary medicine that feeds the retina. Now, those kind of natural medicines are found in nature as well. So, for example, lutein is found, that's what makes the yolk of an egg yellow, is lutein, luteinizing hormone. So we began to develop natural medicine. Dr. Abel, there's a company called Twin Labs, and Dr. Abel is one of the advisors on that. This is during the time that him and I were working together, and he helped them to develop one of their first eye formulas. So he was one of the first developers of eye formulas in the United States way before Bausch and Lomb and anybody else. Over the years, as time went on, we began to learn more and more that there were things missing in these primary formulas. The Western understanding of this included the 3 primary carotenoids I just mentioned, but they also included vitamins like vitamin A, vitamin E, which are antioxidants, and they take inflammation down. So they're also an important part of this process. But what they missed were herbal medicines, because herbal medicines contain compounds in them that have not really truly been discovered. So the difference is between, if you think that the only thing that makes wine work is alcohol, then there's no difference between drinking plain old alcohol and drinking some, fancy French wine. But there's a difference. And when you drink them, you'll tell the difference right away. Your body knows the same thing. So there are compounds, thousands of them, found in plant medicines that can be beneficial to the eye, okay? And so we put together herbal medicine formulas. Now, normally, I run a natural medicine clinic with my wife and my son, family business. We've been doing it for 40 years or more. And we only give medicine to our patients. But Dr. Abel and I decided this was so important because he began to look at the formulas that were out there, like Aireds and all that, and there were some mistakes in those formulas. So we decided we were going to develop some of our own and put some Chinese medicine in there and things like that. So that's basically what you need to know about macular degeneration.
What are some of those ingredients, though? Let people know. And then, of course, you mentioned a mistake. So people would be curious, what do you mean by a mistake?
The Aireds formula contains too much zinc. And then zinc can deplete copper in your body. And so you're taking Aireds all the time. Also, it duplicates what's found in it and has it doesn't have the proper form of vitamin A. And it completely lacks the herbal nutrients. Some of the herbal nutrients that are important for the eye include tianxi root. Tianxi is a herb that grows in China. My wife actually, it's very interesting. My wife, Naisheng, she was taught in Sichuan province in China when she was a doctor in China. And her group in that part was the only ophthalmology department in all of China, like 45 years ago. And one of the main herbs they used in ophthalmology was tianxi root. Tianxi root is a very interesting herbal medicine that was discovered by Chinese martial artists that helps the body to repair after damage. Martial artists would go out and get chopped up in sword fights or whatever. They would come back and they would drink tianxi root. It has to be grown in Sichuan province to work properly because of the soil. And they would heal up faster. So we put that into the herbal formulas to stimulate healing of the little microvessels that feed the back of the eye. Other important things include bilberry and blueberries. So I always tell patients with eye to eat lots of berries and stuff because the compounds that are found in the berries, the anthocyanidins and proanthocyanidins that are found in berries are very healing to the eye. Hawthorn berry, which a lot of people know about, has antioxidants in it that are healing to the inner lining of the blood vessels, the endothelium. And because of that, hawthorn berries are important. Ginkgo leaf, which is another herbal medicine, improves the blood flow to the brain, and that includes the retina. Okay? Ginseng root, if people have weak digestion, they're not going to absorb enough nutrients to feed their nutrient. They're taking the nutrients, but they're not breaking them down and digesting them enough in their stomach. So we add things like ginseng root to strengthen digestion. Sometimes people in Ayurvedic medicine, that's the medicine I studied when I was in Nepal. It's the third largest medical system on the planet, the medical system of India and Nepal in the Himalayan mountains. They have a compound called shilajatu, which is a excretion of minerals that is found on the mountaintops, and they collect it and they purify it. And that particular compound has a very strong strengthening effect on the heart and the circulation. Okay, so those are some of the herbal medicines we use for macular degeneration.
Obviously, depending on how serious somebody's condition is, I just want to set people up with the proper expectations. From your 40 years plus of experience, somebody's dealing with this. It's not like they're going to take a pill and the next day they feel better. What's the way that someone should expect the healing to take place? How long does this have to take before they feel something?
You can actually measure the thickness of the RPE, the membrane on the back, and studies show that with proper nutrients in the proper doses, you can thicken the RPE by 50% over 6 months to a year. And so that is doable thing. Now, that will work in a person that doesn't have other underlying issues. In natural medicine, you're going to be taking any patient that comes to see you and go through their body system to see if there's anything else interfering in their ability to absorb and utilize the nutrients. So there's more to it than just that. We put together this formula called I-Complex CS, which is basically all the nutrients from all three systems of medicine put together for treating the eye. And we've had a lot of success using it because while Dr. Abel, he's retired now, for the 40 years we were working together, I would treat the patients, and I would send them over to his eye clinic, and he would measure stuff, and we could see the results right there over and over.
And it's a great point you're bringing up as well, depending on what someone does in terms of how consistent they are consuming these foods, really, but also what else are they doing? Are they on high blood pressure medications, statins for their cholesterol, all kinds of things? Absolutely will have an impact on how well you can heal the body. Is that fair to say?
That is absolutely 100% correct.
So let's move on to glaucoma. Obviously, people very concerned about that out here, and that's pressure in the eye in particular, and obviously wanting to improve circulation, but then again, being concerned, oh my goodness, increasing circulation perhaps maybe adds more pressure to the eye. How do you address all this with herbal medicine?
Yeah, it doesn't quite exactly work like that, okay? Inside the eye, there is a little gland called the ciliary body that secretes fluid down into the front of the eye. And then there's a little drain pipe called the trabecular meshwork where the eye fluids come out, okay? If the ciliary body is producing a proper amount of fluid, it comes down and then that bathes the eye and helps to keep it healthy, and then it drains out at the bottom. If there's a problem either with the secretion or there's a problem with the drainage, then it blocks up and then the pressure builds up. That doesn't have to do with circulation in general coming up. In other words, you're not going to get glaucoma by being an athlete and having great circulation. What happens is actually that as you get older, the concept of microcirculation is very, very important in ophthalmology because the blood vessels that feed into the back of the eye are super teeny, like little tiny threads. They're very, very tiny, and they can easily get congested. And because the eye is a nerve tissue, anything that blocks the circulation to a nerve tissue can be extremely damaging in a very short period of time. Even seconds or minutes without enough oxygen can begin to initiate a damaging process. So your body has all these mechanisms to make sure that the circulation is maintained. And I said, as people get older, the circulation goes down. And one thing that happens is, we mentioned earlier, macular degeneration, where the retina begins to thin out. It gets starved from not having enough circulation. But in glaucoma, what happens, the body kicks in and it releases inflammatory chemicals in order to restore the circulation. For example, if I take my hand and I cut off the circulation with my fingers on this hand, what's going to happen is there's not enough circulation in my hand. It's going to start to turn cold. And after a certain period of time, if that goes on for too long, the little white blood cells in there are going to start to release inflammatory chemicals to try to bring the circulation back. The problem with that is that when that happens in the eye, the circulation is down, the body's releasing inflammatory chemicals in order to bring the circulation back. What ends up happening then is that it causes a change in the pH, and when there's inflammation, and that creates inflammation. So it's an inflammatory process that gives you a short-term benefit, but over a period of time, that inflammation starts to release little particulate matter that gets into and mixes into the fluid and changes the pH of the fluid. Okay, that's called PEX syndrome, which is sort of like dandruff. Like when you have a lot of dandruff on your hair, you don't have enough circulation, the hair gets dry and you get dandruff. And then that goes to those little particles go down and they block the drain pipe. You see what I mean?
You know, you're really illustrating so well something that's been a common theme throughout this entire program, talking to all the great experts like you. When liver is dysfunctional, when you're eating too much glyphosate, when you're eating too many processed foods, when you're consuming all this chemicalized food that's out there, if your environment, your air is polluted, wherever you're working or living, the list goes on and on and on. All of this exposure is too much for the body. The eye can really be telling way before you even have more serious disease symptoms that something wrong is going on and you have to change the way you're living, right?
That is absolutely correct. So that's why the actual medicine you give to the eye, which could be 1 or 2 formulas, may be only one of 5 or 6 formulas that the person needs for the other underlying issues. Now, getting back to glaucoma, once that trabecular meshwork is blocked and the pressure goes up, what the eye doctors do is they have medicine that will either reduce the secretion of the fluid or will relax the trabecular meshwork in order to put the pressure back. And that does work, and it is important, but it doesn't get at the underlying issues that are going on there. So for that purpose, we developed a medicine that I developed. Now, this one is kind of a complex, so it's only available to my patients, but we call Ifolia, which has the herbal medicines that do several things to help with glaucoma. One is to help to lower the intraocular pressure by increasing microcirculation and removing congestion in the tiny blood vessels, okay? Now, the medicine I mentioned earlier, tangy root, is a major factor. So the dose of that becomes very high when you're treating glaucoma, okay? And then the bilberry extracts are very, very important for bringing that circulation back to the tissue. So that becomes an important part of a treatment for glaucoma. But then there's another component that almost nobody knows about. Very few people know about it, that once the oxygen level is down, there's a time frame where it's going to take you 6, 8, 9 months or a year to bring that back. What do you do in the meantime? What happens is that when there's not enough oxygen to a nerve tissue, a chemical builds up there called glutamate. And glutamate is damaging to the nerve fibers. So Dr. Abel and I wanted to find out what our medicine was doing. We were getting these really great results. And we got an opportunity to work with a Dr. George Ayub out at the University of California, Santa Barbara. He was working in actually a small college right next to there. And I was out there teaching a seminar on multiple sclerosis. He decided he wanted to measure our formula in the laboratory, which we did, the one called Ifolia. And that's the name we give to it. And he found out that it was very effective at blocking glutamate, pretty phenomenally effective at blocking glutamate. And then if you block glutamate, what happens is you buy time, which means within just a couple of days of starting this formula, you are already protecting the optic nerve while you wait for the other nutrients to kick in.
Oh, it's interesting what you were talking about, probably way too much for this discussion because I want to move on to retinopathy. But people, you talked about MS, nerve damage, tissue damage, all of these things. I hope most people watching this program can appreciate the fact that all the artificial colors, dyes, flavors like aspartame can be very destructive to the body, especially the eye, no?
That is absolutely true. So you need to be healthy for any disease, not just eye diseases. You have to have real food, close to nature, minimally processed with lots and lots of vegetables, organic if possible, and avoid junk food and sugar. That's the basic. You got to find an environment, get out in the sun. You have to be able to walk and get sunlight. You have to be able to have fresh air and be able to, and avoid wheat products with glyphosate or Roundup in them. A lot of people think they're sensitive to gluten. They're actually sensitive to the glyphosate or Roundup that's throughout all the wheat products. I have a number of patients, many patients, who travel overseas and they can't eat one bite of a wheat product here in America without getting sick to their stomach. And they can go to Europe and they can eat bagels and they can eat pasta without any difficulty whatsoever because there's no glyphosate in it.
So let's move on to helping people with their blood vessels because God knows they need the help, especially those, as I mentioned earlier, with hypertension or diabetes. We're talking millions and millions of people in the Western world for sure are dealing with these conditions. Very, very destructive to eye health. How can herbal formulas, herbal medicine help those people?
So if you're a diabetic, for example, and I would develop type 1 diabetes when I was 10 years old, and my vision currently is 20/20 with correction. Okay, and I've been a diabetic for 65 years. Okay, since I was 10. I'm 75 now. I just had my vision checked last week, and I'm 20/20. So things that are beneficial for the blood vessels include not only tianqi. If the person doesn't have building enough healthy blood, we use dongui, which is a Chinese herb that builds blood. If we don't need more circulation besides TNC, there's another herb called Don Sun or salvia root, which is a Chinese herb that's very important for improving blood flow. I mentioned hawthorn berry earlier, ginkgo leaf I mentioned earlier. All of those medicines are extremely important for the circulation. But just eat a lot of berries. I tell people, eat a berry. They're low sugar. You get organic berries, and wild picked berries, and they're just wonderful for your eye health, including not just berries, but all berries, wolfberries and elderberries, all the different berries, raspberries, blueberries, all of them are extremely good for your eyes.
Can we talk for a moment, if we can sort of take a step back as to the formulations? How should this be consumed? I mean, besides some of the foods that you've just mentioned, the herbal formulas, is it better to have capsules, the powder form, just straight in water? Is it liquid tinctures? Can you talk about that for a minute or two?
The normal medicine that's easiest for people to consume is going to be in pill form. You have to get herbal powders, but whenever you're getting herbal powders and then making them into capsules, in order to make it easy for people, you have to get a high-quality company that makes pharmaceutical-grade extracts and concentrates them down 5-to-1 or 10-to-1. Otherwise, the amount you have to take, like when I was living in China, when I was living in India, Nepal, you would go to the herb doctor and you get a big bag of herbs, and then you'd have to take it home and cook it up on the stove and drink this black soup 2 or 3 times a day. Now, that kind of doesn't quite fit with the American lifestyle. You have the herbal medicine companies will take these things, and if they know what they're doing, they will make these powders and then concentrate them down, and then 5-to-1. And then you can take 4 or 5 capsules a day and get the equivalent of taking a big pot of soup. Tinctures are a little different. If somebody has very weak digestion, and tinctures are easier to absorb by quite a bit. And sometimes their digestive systems are really, really weak, and you can bypass some of that by using tinctures. For purists, they like the pure powders. You can do that. And you can get the powders to mix them up yourself and cook them into teas and all of that. And there are people that like to do it that way, although that's less common these days. So those are some of the different ways of consuming natural medicine. They have a lot of other medicines too. They put them into syrups that they make with various kinds of fruits. The Ayurvedic doctors had a very interesting compound where they would extract things with water into a soup, and then they would cook it into oils and put it in with ghee, which is a kind of a clarified butter. And then they'd make these herbal ghee things which taste like tablespoons of butter, and they would put their herbs in like that. And the ghee becomes a carrying agent that helps the nutrients. They have a concept in Ayurvedic medicine of nutrients that help to bring the medicine to your eye. And that brings up another important point, which is that there's not an herbal medicine, but there's a compound called lipoic acid, or lipoic acid, or alpha lipoic acid. Or lipoic is the more concentrated form. And that one because it has the ability to bypass, it's both fat and water soluble, it can help to carry nutrients into the eye. So I usually put some lipoic acid in as one of the medicines I use along with the herbal treatments to improve delivery of the nutrients to the eye tissue.
It's very interesting what you just did. It's almost as if you were reading my mind. I wanted to ask you about another thing that you could maybe address for just a minute or so. So many people, conventionally speaking, might take pills, let's say, just regular pharmaceutical drugs, and they just pop them in their mouth and swallow. But here throughout this program, we've been talking about how you have to be very careful, even if you're attracted to herbal medicine, that generally speaking, you're not so dehydrated or a person so afraid of fats that you're barely eating any kind of healthy fats at all. And then on top of that, you're eating maybe some things that are junky. Can you please speak to the importance of being well hydrated and having healthy fats, as you were just talking about with the ghee, that would actually enhance the effectiveness of herbal medicine?
And not only that, but the extracts from fish oils, the omega-3 fatty acids, the cosechtinoic acid and eicosapentaenoic acid, the compounds that are found in fish oils, those medicines, fish oils, are another component. Studies have shown that the rate at which you can thicken the RPE, the membrane on the back, that when you take herbal nutrients, is enhanced when you take it along with fish oils. So yes, and that fish oils, the reason fish oils are so important is because all your membranes, every membrane, every cell in your body is made of fats and oils And one of them is these omega-3 fatty acids are part of the components of every cell in your body. And if you have too many omega-6s, and which come from meats and things like that, and you don't have enough omega-3s, what happens is your cell membranes become a little more denser and more likely to be inflamed. If you have enough omega-3 fatty acids in your diet, whether you get them from natural sources like gamma-linolenic acid, evening primrose oil, or whether you're getting them from fish oils, when you have a balance between the omega-3s and the omega-6 in your body, then that creates an environment which has the least amount of inflammation.
It's a very important points because, again, I want people to be very clear about the kind of foods that they select throughout the day, as well as using the herbal medicine that you're suggesting here. Too much sugar and not enough fats makes it very difficult to think that if you're going to pop some herbal medicine pills, that's going to help you out. You know what I'm saying, right?
Before anybody even goes to my clinic, when they sign up to be a patient on the website, what happens is they get a little handout called Welcome to Crystal's Natural Medicine. And in that has a little article about healthy diet and exercise and fresh air and drinking water and all that kind of stuff. And that's the basis that you begin with. You can't do anything without that. You can't build a house unless you build the foundation first. You can't put the bathroom in until you've dug the hole, put the basement in, and put the water pipes in. So that's the beginning level of every basic thing. And that's something that's missing in Western medicine, sadly. For example, if you go to the ophthalmologist, any ophthalmologist, unless they're trained in natural medicine, which is a very tiny percentage, they will never, ever in a million years ask you about your diet, ask you about your exercise, any of that stuff. It will just be missing. You'll come in, they'll dilate your eyes, they'll measure your eyes, tell you all about your eyes. They do a great job. They know what they're doing, but they don't ask those things. And therefore, patients are not going to be anywhere near enough to getting better with only that one intervention. You need to have more than that. And they depend on the family doctors, and family doctors don't do it either. They don't have enough time because of the way our medical system works. And even if they do have enough time, they're not trained in it. I taught a class at Jefferson Medical College in Philadelphia, and I asked the medical students, third-year medical students, 60 of them, and I asked them, how much training in nutrition have you had? They're going to medical school. 2,750 hours of medical training over 4 years, after 4 years of college, right? And they said the answer was, well, there was one course in nutrition taught by a dietitian. It was 4 hours long, but it was elective, and only 3 out of the 60 had taken it. In other words, they know nothing about, and no disrespect, but they know nothing about nutrition.
Dr. Tillotson, it's amazing because everything you're speaking about is well grounded in the literature. But as I often say in a lot of the programs, people need to realize that what they're seeing in the office is a very far cry from what's actually grounded in research, and it rarely ever gets to these doctors to communicate with people. Why don't we talk a little bit more now about some other herbs that maybe you haven't mentioned that are a bit lesser known that would really help people with certain eye problems that are out there? Farsightedness, nearsightedness, astigmatism. I don't know. You can talk about it however you like.
Let's talk about uveitis, okay? That's chronic eye inflammation. Uveitis, there's 3 or 4 different types, but basically your eyes all red and inflamed. Now, over the years of treating uveitis, what I found out was that over 60 or 70% of these people have a condition called dysbiosis. That is, they have eye inflammation, so the doctors are putting steroids into their eyes, and it kind of works a little bit, but eventually they can go blind from this, right? Sometimes they start putting them on IVIG, very powerful immunosuppressants to stop this. They treat it as an autoimmune disorder. But I found 60, 70% or more of them have a condition called dysbiosis. That is an imbalance in their gut microbiome. There's bad guy gas-producing bacteria causing gas, bloating, fatigue, and all that. And that inflammation that's produced in the intestinal tract is absorbed into the blood, and then it goes to different places. And in some people, the dysbiosis causes arthritis. In other people, dysbiosis causes, colitis. In other people, dysbiosis causes diabetes. But in some people, it causes uveitis. So in order to treat uveitis, I have to first treat, before I even give them a single herb for their eyes, I have to first treat the underlying disease process there. Now, I learned how to do that when I lived in Nepal again, because that's a third world country, and a lot of people have very poor sanitation. So I learned herbal medicine combinations. I use something called DMA pills, which is based on the name of my teacher in Nepal, Dr. Mana, we called him for short. And then those are herbal medicines containing neem extract and ajwan seed and several other herbal medicines. And they will kill down all the bad guy bacteria in the intestinal tract. We put people on a low sugar diet to avoid feeding the bad guy bacteria. And then we give them probiotics. So you kill down the bad guy bacteria. It takes about 2 or 3 months to do this. There can be, I give you something visual. The microbiome in the human intestinal tract is 2 to 4 pounds. It actually weighs 2 to 4 pounds. You can have an entire pound of bad guy bacteria in your intestinal tract causing 20 or 30 or 40 different kinds of diseases. And it takes a couple of months to kill that pound of bad guy bacteria off and replace it with good guy bacteria by having people eat yogurt and kimchi and natural probiotic foods or taking probiotic pills. That in process is an underlying thing that I have to use for almost all my patients, not just eye patients, as a preliminary thing that we do. Main herb we use for that is neem extract and ajwan seed. We also use a compound called berberine, which is extracted from Berberis species. And those compounds are able to kill down the bad guy bacteria, but that's not enough. And then you have to restore the good ones by using probiotics or probiotic foods.
I'm curious, how do you decide between, you know what, you should just consume this particular herb or another kind of herb, or sometimes you say, you know what, you need a complex of many different herbs in one formula. Is there a decision-making process you go through to decide which is better?
That's called formulation. And you learn in both Chinese and Ayurvedic medicine how to formulate herbs. Now, some of the early formulators was based upon the concept people had at the time of kings and courts, and they had jesters, and they had, actors, and they had courtier people in the court. And so the main herb that you use when you're making a formula, whatever the problem is, let's say I'm treating this problem with glaucoma, so the main herb might be the tianqi. Okay, that's a primary herb. That would be the king. And then another one could be the berries that we were talking about. That would be the queen. So those would be the highest part of the formula. But then you have to ask the question, how do I make sure they're absorbing it? So I might put in some black pepper, some ginger, some trikatu, Ayurvedic medicine for strengthening digestion, or Chinese medicines like the Four Gentlemen decoction, which is used to strengthen digestion. That's to make sure that's properly being absorbed. Let's say the patient is very nervous, and that nervousness is getting in the way of him doing stuff. So then you put in some ashwagandha, which is an Ayurvedic medicine that helps to calm the nerves down, which has very healing properties for the nervous system. And then you look at secondary nutrients that might possibly be important for that particular problem. If there's inflammation, you might put some chrysanthemum root in there, which takes down inflammation in the eye, or Buddleia flower, or curcumin from turmeric, which takes inflammation down, or gentiana root, or eclipta, or dandelion. Those are all compounds that are used to take the inflammation down, and that's how you make a formula for a patient. And then once they come back to see you, it's a feedback mechanism. So when they come back to see you a month later, then you look at the results, and if you find out they're not calm enough, you add a little bit, increase the percentage of the calming medicine, or add another calming medicine. If you find that they're overly calm, you might cut that back, and gradually find a formula which nourishes and heals their particular tissue and nudges them back towards health.
I love what you're saying at the end. As we close out, I wanted to finish up with something that's so important so that people don't get sort of lost in the weeds, if you will. I'm going to find out now. I'm going to work with someone like you, Dr. Tillotson. I'm going to get some herbal medicine, and I'm going to take it for my eye, and my eyes are going to feel better. And it's sort of a Western mindset. And where I'm going with this is, as we finish up, I really want you to hit in on how important it is that people, if they're struggling with their eyes, to actually think about their gut health a lot more. Because as you were referring to before, nervousness, congestion they might see in the eye, a bleeding in the eye, whatever it might be going on in the eye, something else is off in the rest of the body, and people should be thinking about improving their gut health, their elimination, the health of the tissue in and around the gut. All of this, as this improves, so will eye health. Is that fair to say?
That is 100% correct again. Nothing more can be said. You said them perfectly.
Okay. Thank you, Dr. Tillotson. A lot of your information obviously would take working with someone who really is experienced in herbal medicine. I know you've mentioned your place up north in the United States. Are you available for people to reach out if they wanted to talk to you, but they couldn't travel? Do you do anything online?
I do video conferencing all over the world. And also, if you want to become a patient, there's a little form you can fill out. I see. Now, I have some, restrictions on who I'll be able to see because I'm kind of popular. But definitely people can go there. And like I said, the one medicine we use for the eye that's the important one, Dr. Abel insisted we make that available to anybody. So anybody can go to our website and get that one eye medicine because he just thinks there's millions of people that need it.
I'm sorry, which one was that? So in case people missed it before.
Eye complex CS. That's the only medicine that you can get from my clinic without being a patient.
And again, the purpose of that would be, just give us a quick overview.
It's our macular degeneration medicine with all the herbs from China and India that I mentioned at the beginning of the program.
Okay, very good. I hope people listen to this again to get even more out of it. And I know the information you provided will be very helpful for a lot of people using herbal medicine as a tool in their toolbox to help nourish their eyes and to protect them all the years of their life. Thank you very much for your help.
You are very welcome, Jonathan.
Up next, I'd like you to meet Dr. Richard Laudon, a top expert in the field of vision therapy. Dr. Laudon will reveal how vision therapy can benefit both children and adults, helping to eliminate eye strain, improve focus, and even resolve reading difficulties. You'll hear why his holistic approach is so vital for kids in school as well as adults looking to stay sharp in daily life. We'll also expose some surprising myths about vision therapy, truths that most eye doctors never mention. Get ready to discover a whole new way to support your vision naturally and effectively. Enjoy this presentation with Dr. Laudon. Dr. Laudon, we spoke a little bit before the cameras were rolling about how honored I am to be able to spend some time with you. 50 years helping people with their eye care. Doing this as a profession, that's a long time. Before we get into vision therapy, and I know a lot of people are going to learn a lot of things from you about what vision therapy is all about. Can you please talk about your professional background? It's quite extensive.
When I went to optometry school, I initially went because I thought I was going to be a contact lens specialist. Ironically enough, the last contact lens I got was during my state boards, and I haven't put a contact lens since that time. And I developed an interest in vision therapy. The interest was based on the fact that most of my classmates weren't that interested in vision therapy. So I was actually doing vision therapy with another doctor, Indra Mahindra. And after I graduated, because of circumstances, I actually was hired as a faculty member. And I started my career at the Massachusetts College of Optometry, which gradually became the New England College of Optometry. And I retired on my 70th birthday. And I am still involved in the field. And I have strong interests about the fact that there is a lot of misperceptions within the field of eye care. And that's where I am now. I do some writing on Medium in relationship to vision, health, as well as finance.
And I know we're going to focus our attention today on vision therapy. A lot of people, perhaps in the holistic field and in eye care, they might bring up that term. People may have heard it. Please define it the way you look at it, what your vision therapy is all about.
Vision therapy is a structured series of exercises to improve visual problems, functional visual problems. Early in my career, I was actually considered a snake oil salesperson because the claim was that there was no research. And even though vision therapy was effective with patients, it was criticized. It is still criticized by some people within the medical profession. And basically, it's a form of physical therapy for the eyes. One thing people seem to be over-focused on is what they call perfect vision. And that refers to a phrase that somebody has 20/20 vision. And most people who've had their eyes examined, that's the phraseology that they learn. And all 20/20 vision tells you that you can identify symbols or letters at 20 feet. The problem is that there's more to vision than just reading letters at 20 feet. And some doctors will only evaluate one eye at a time. They'll evaluate the right eye. They'll evaluate the left eye. And they don't even evaluate the two eyes together, when in reality, that's a mistake. I actually think 20/20 vision has actually been a curse for certain patients, because many children that I work with had 20/20 vision. The problem is that they had two eyes that didn't work together, they didn't focus together, and they didn't track appropriately together. And they would go to eye doctors and complain of headaches, blurred vision, eye strain, and they would be told that they had 20/20 vision, so it had nothing to do with their eyes. And after 50 years of doing this, that is the wrong statement to make. You have to evaluate the visual system beyond an ability to see letters at 20 feet. And you have to look at the eye exam lane itself. You're sitting in a chair, looking through these small lenses, identifying through different lenses an ability to see those letters. Vision is dynamic. We use vision from the time we wake up in the morning till the time we go to sleep at night. And we're making an assessment. In many cases, doctors are making this assessment in a 5-minute evaluation of visual function. The rest of the exam is all evaluating eye health. And it is true that the eye is a window to health. You can get a view of whether somebody has changes in the back of the eye that could indicate problems with hypertension or diabetes or other changes. But if you're working with children, they don't have those types of problems. There are exceptions to that, but they have functional problems. Those functional problems affect children's ability to function in the real world, which is school. And I'll give you an example of the insanity in this realm. There are many doctors who do not believe that eyes have anything to do with reading. So my challenge to those physicians, and I've heard this throughout my career, is to close your eyes, read a chapter in the book, and then tell me what the content was. Now, when I use that example, I am not saying to anybody that eyes are all about reading. Eyes are part of the reading process. If you can't get the information through your eyes, then that's a potential problem. If you have symptoms, which are again within the realm of headaches above the eyes, which occur as they read, blurred vision where the words move around, or double vision, or when you read, you skip your place, that interferes with the child's ability to read. Now, another point that I want to make on that is there is what I call avoidance. So if a child has basically struggled with reading, has symptoms, goes to doctors who tell them and their parents that the child has 20/20 vision, the child learns that it's not worth complaining about. And what they do is they start avoiding the task. And I've run into situations with children over my career where parents have said, my kid doesn't read because they're just plain lazy. Well, that is not true. And we need to do a more in-depth assessment of the child's visual system before we make a decision that is not visual in nature. And you need to be interdisciplinary. So my wife happened to be a school psychologist. And when it came to evaluating children, I learned fairly early in my career that it was not all about eyes. There are other factors that we have to look at. And that is something you need an interdisciplinary team. But if you eliminate vision from the equation, there are many children who are going to suffer as a consequence. And that even includes adults. There are adults who will tell you that they don't read because they're too busy. Another way of saying it is it's not an easy task and it may cause some problems. So the best way to deal with it is avoid it. If I go into my early part of my career, I spent a good deal of time with children who had visual-related learning problems. Now, it is also important to understand that I have a functional visual problem. I have what was called a convergence insufficiency. The problem I had is an inability to coordinate and focus my eyes. And that did have an effect on my reading, along with the fact that I happened to be born on December 31st. And when I went to school, I learned that there can be issues in developmental lag, because I went to school with some individuals who literally were almost a year older than me. And so it was difficult to compete when you have people in your class who are literally almost a year older than you. And one statement I remember to this day is my mom said to me when I was in the first grade, she said, "You know, Richard, you do very well, but you seem to fall asleep in the afternoon sessions." And that has stuck with me for all these years. What it points to is there are some developmental issues between boys and girls, especially in the early years. And so that has to be taken into consideration when we look at their ability to function in the real classroom. Fast forward to the current century and the latter part of the 20s, concussion. Concussion was the type of patient that I saw before I retired. Now, concussion became widespread in regards to understanding because of the book about the center who played for the Pittsburgh Steelers. There were all types of symptoms related to the eye, and initially that was completely ignored. Completely ignored. Brain fog, attentional issues, problems focusing, all of those problems were literally presented to the team, but they ignored it. And the reason they ignored it is because the acuity, visual acuity, the sight appeared to be adequate. They ended up in my clinic because they had already been seen by the specialist. They already had gone to Mass General Hospital. They already had gone to Children's Hospital. And many of those people, including adults especially, had vision problems that required vision therapy. And if it wasn't for vision therapy, they would not have achieved the quality of life that they needed, or they would have suffered. Now, it doesn't solve everybody's problem, but the fact that it's not offered to many people, and what you hear is you have good vision, quote, sight, so you don't have any other problems, is an inappropriate statement.
Yeah, and I wanted to make it clear that what we're talking about here is not just limited to children. Everything we're about to continue to talk about is for adults as well, right?
Yes. The conditions that tend to be right now acknowledged by the medical profession as well as the optometric profession that people think about in children is lazy eye or amblyopia, or eye turns, esotropia or exotropia. Esotropia where the eyes cross, exotropia where the eyes turn out. That's where people constantly focus in regards to children. Now, amblyopia, lazy eye, has been around for centuries. It was at one time treated only with a patch. They would put a patch on their eye, and they ultimately would say by doing that, they're forcing the good eye's patch, they're forcing the weaker eye to function. What's important is that over the years, and even now, we're still debating that in some doctors' minds. At one point, they believed that it was not cured or not, there was no ability to improve vision after the age of 6. We have now found that to be false. You can actually treat amblyopia in adults, and I have done that in my own career. The problem in children that we're seeing that are not being diagnosed is problems in eye teaming, eye focusing, and eye tracking. Those are problems that we see in children. So these functional problems you see in children and the eye disease problems you don't see in children as a high percentage. They're very important. Nobody wants to see a child with an eye disease that could cause loss of sight or even more. But over the aging process, you see the reversal of that. You see less of those functional problems, but you also see now an increase in pathology. When you reach your 40s, and most of us hopefully notice in that time frame, you start to lose your focus ability. That's called presbyopia. And for adults, when it comes to understanding a focus problem in a child, it's a perfect way to understand it. If you have your glasses, you can focus in your 40s and 50s when it comes to reading. If you don't have your glasses, it's difficult to focus. And so you need your glasses. In children, they have a similar type of problem, not caused by the same mechanism of maturity. I don't like to use the word aging, but they have a similar problem in the focusing system not working properly. And sometimes it can be resolved by glasses, and sometimes it requires vision therapy. And so I do see adults, I see college students, and I see adults who have these functional problems, which can become worse as you go into your 40s, because the visual system is under tremendous amounts of stress. So to eliminate adults from the vision therapy realm would be inappropriate.
But as I'm listening to you, tell me if I've got this right, because it's easy to sort of miss your message here, and I do want you to correct me if I'm wrong. I'm listening to you talk about a real functional problem, not so much like glaucoma, cataracts, like eye dis-ease, but a child especially who cannot track words on a book, read something. Talk about a child who doesn't have full maturity and they become more emotional. The behavioral problems that come about, the lack of attention that it appears on the outside, people looking at this person, this child, they're frustrated, they get angry. All of this behavioral stuff is stemming from a functional problem. But what I'm visualizing so often must be going on is these children are being labeled with quote unquote behavioral problems when it's a matter of just sitting down with someone like you, well-trained, appreciates what could potentially be the problem, and really identify a functional eye issue. And if that could be fixed, oh my God, the child would be completely different in their behavior. Is that fair to say?
Let's use your example, which is a way of explaining to parents this dilemma. You're absolutely correct. The issue is that this frustration in school, this failure in school, which is obviously going to affect their self-esteem as well as their ability in their peers. What's important to understand is there are ways of being a good observer as a parent and starting to understand this more. So let me give you some examples. Kids who have potential functional problems may hold books and tilt their head. They may hold books too close. They may squint. They may close it on. They may show you indications of a problem when in reality they go to the eye doctor and he says they have 20/20 vision. That is not the way to look at the visual system. ADHD or attentional deficit is going to impact itself by the visual system. Your attentional mechanism is very much loaded with vision. Now, it also is impacted by auditory, and all of that information is going into the attentional system. So let me give you another example. The child who can read when they can listen, they can read through their ears, which is often referred to as the dyslexic child, has a potential vision problem. Now, not all dyslexics have vision problems, but if a child has an ability to understand reading through the auditory sense, well, we want to make sure they don't have what I call a visual interference factor. And so you want to rule out the focusing, the teaming, and the tracking. And that will not be determined by a child's or adult's ability to see 20/20.
I'm also wondering about something else you said very quickly at the beginning, and I'd like you to address it just for a moment at least. Controversy. How on earth could something like vision therapy, everything you just said, be controversial in anyone's mind?
Because we are talking two different languages within two different professions. The medical profession looks at the eye as a structure, which basically responds to surgery and medication. And after that, there is no alternative. And vision therapy is functional. And if you've ever had a problem in regards to occupational therapy or physical therapy, that is certainly where you would go first before you would have a surgical procedure. And yet, when it comes to vision therapy, and there have been statements from ophthalmology as well as from pediatrics that looks at vision therapy as hocus pocus. I have had doctors tell parents, it's not worth spending that kind of money. Why don't you go on vacation? They're not looking at anything other than the fact that they are making the decision that it doesn't work. Now, let me give you a couple of points in regards to that. When I did vision therapy, I expected results within 3 months. And when you do therapy, we happen to use a combination. I work with students, so they were my therapists. And if you want to have problems with therapists, you want to work with students, because the students were only with me for 2 days a week, and they were in a rotation for 3 months. And many of them came in because some of my colleagues were not fans of vision therapy. And when they came into my clinic, they were very skeptical. And in truth, some of them shouldn't work with children. Not everybody should work with children. There are people who basically don't have that type of rapport. They don't have that type of empathy. They shouldn't work with children. I had students that shouldn't work with students. But by the time the rotation was over, they were understanding that there was more to vision therapy than the hocus pocus that was being shared with them by other people. So if you do vision therapy, the one thing that happens very quickly is you create more stress on the visual system, and it creates symptoms. So symptoms literally get worse before they get better. And then I found within a period of about 10 days, those symptoms start to disappear. And when we go through a 3-month program, which is the one that I was involved with, by the end of that program, people were at a point where they were able to compensate for their problem. And this is a very important statement to make to you. I don't cure these problems. I don't have the ability to cure it. I teach people to compensate for it. And if they compensate for it, it eliminates that symptom level and they function better. And then we follow them up 3 months later. If things go well, we could probably see them in 6 months or a year. I personally have and I had an eye teaming problem when I was in optometry school, and it was simply treated with lenses. They gave me myopic lenses. They continued to increase those, and that did not solve my problem, which brings me to another area of concern for your viewers, and that is myopia, nearsightedness. That is rampant in our society today. Now, do you know who the first person who identified myopia was? Aristotle. Aristotle was the first one that noted myopia, and I can tell you today that we don't understand a lot about myopia compared to what Aristotle knew, because it is not strictly genetic. The numbers of people who are becoming myopic today, especially in children, is very significant, and it can't be just a genetic malfunction. It has to do with our environment. Our environment has changed from being outdoors, and now we're indoors. Now we're spending all this time on devices. You see young children, infants, and they're with their iPads. That is going to create stress on the visual system and potentially cause myopia, in my opinion. I think myopia is an adaptation to the new environment that we currently are living in. And so I've written some articles about visual hygiene. I actually had an article written about visual hygiene, which is not exactly like dental hygiene, but what it refers to is changing some of the visual behaviors. And I had an article written in the Journal of Clinical Ophthalmology. So the people who have criticized me for most of my career in regards to vision therapy and in regards to being an optometrist, besides being the real doctor, actually published an article which I wrote, and it was visual hygiene, a misunderstood concept. What it means is when you read, you need to take breaks. You don't want to be staring at a screen literally for hours at a time, because what that does is it causes the visual system to overcompensate. So a good rule of thumb, especially with adults, is to take breaks. If a child is reading, they need to look up periodically. And when you look up periodically, and I use that as after a page in a book, if you look up and it's blurry, it means your focus system is overcompensating and you need to take a break. And the other thing, which we talked about a little bit earlier, is you need to move. So sitting has become the new smoking. And so you need to take breaks. You need your body to move. One of the interesting things about myopia is that one of the approaches is to get the kids to be outside. And the question there is, well, is that got to do with the sun? Does that have to do with the fresh air? Or does that have to do with the fact that when you go outside, you don't have your computers, you don't have your books, you don't have your iPads? We need to change the visual behaviors. And I also did a visual hygiene list for young parents with young children. Because what I also learned is a lot of parents, because of the way the society is, they look at people who have to wear glasses as being defective. And so instead of bringing their children in at an early age to be evaluated, they're in denial. And I found many instances where parents had significant vision problems where they probably were hereditary, but they'd never brought their children in to see me. And it was kind of ironic because I had patients that stood out to me that were they had significant refractive errors, meaning they had severe farsightedness and astigmatism. And the reality was they brought their child in, and I found a similar problem. And I asked them about that, and the response was, oh, I have that problem too. And they didn't even think that potentially their child should have had an eye exam at an early age. We need to educate people, and that's obviously what you're doing here. People need to understand the power of vision. And if you want to understand the power of vision, close your eyes. Close your eyes. See what you can get accomplished. And you'll realize how difficult it is to function in this world without the visual capabilities that God has given us.
I think probably before we get into the details, I'm sure a lot of people are wondering, what does this vision therapy look like? I'd like you to go into those details soon. But first, can you just please clarify nearsightedness, farsightedness? I mean, does this also include cataracts, glaucoma? I mean, how far and wide does vision therapy actually have the ability to help people out?
What you're discussing is another area where there's a little bit of misinterpretation. So we have what we call refractive errors. Refractive errors is why most people go to the eye doctor. And when they go to the eye doctor, they learn that they are nearsighted. Nearsighted people basically have an ability to see up close, but can't see far away. That's nearsightedness. Farsighted people have an ability to see far away, but struggle up close. Now, what's interesting is that there is a word called astigmatism. Astigmatism is where there's a difference in the spheres, and astigmatism is the most common refractive condition of all, and we don't talk about it. And why don't we talk about it? Because it's very difficult to describe. And I'll give you an interesting insight into that. I had the opportunity to lecture overseas, and in Italy at the time, this goes back a number of years, decades even, the ophthalmologist would not allow optometrists to prescribe astigmatism. It's the most common refractive error that exists, but they decided that optometrists, in the hands of an optometrist, astigmatism would not be appropriately prescribed. Now, I can tell you, in my experience, it was never prescribed appropriately in many cases by ophthalmologists, but that's a story for another time. But those are the three conditions. You also have a difference refractively between two eyes. So one eye could be farsighted and the other eye may not have any prescription at all. Or you could have a farsighted eye and the other eye may be nearsighted. That's called an anisotropia or an antimetropia. When you talk about refractive error, the one area that vision therapy would be helpful with is what we call pseudomyopia. You have a nearsighted person, but the nearsightedness is not truly the structural change. It's got to do with a focus problem. And in that case, vision therapy may be of value. But in most refractive conditions, depending on how embedded it is, very often the best approach to that would be glasses or contact lenses.
So how exactly do we before again we get into the vision therapy and what that actually is, you're going to describe in more detail so people have a really clear picture, no pun intended, as to what you're talking about. How do I identify the problem? You mentioned earlier, you're tilting your head, you're squinting. How do we know that something we're actually experiencing could be helped with vision therapy? What are some of the things that people are experiencing?
Well, we're back to basically looking at the complete profile. So the profile is that basically we are very good at dealing with symptoms, because symptoms basically give you some insight into a problem. We also use observation. You want to be a good observer. You want to see if a kid can stay on task, if they get frustrated. That is the observational aspect of it. If they're having problems in school and you're getting some feedback, you want to get the kid examined. There needs to be a baseline. And the sooner you get a child evaluated, the sooner we take a look at doing things preventively versus from an emergency basis. And there are many people now in the optometric realm where they are evaluating infants. So it's a matter of getting a baseline. And so with children, they should be evaluated. I'm not going to say to you that every infant should be evaluated, but I would say to you, by the time a child is in a preschool environment, they should have had an eye exam with somebody who's capable of working with that type of age group. And I would not assume that every doctor is capable of working with young children, but I would say to you that I would recommend highly that they go in and get an evaluation.
But what is the evaluation? In other words, what are they going to see to say, you know what? I see something going on. I'm the professional. I'm going to tell the parent or the adult, I see this is going on with you. We're not talking now about whether you have 20/20 vision or not. And because I see XYZ, I think vision therapy would be helpful for you. What is it that when you evaluate it, you go, you need vision therapy?
Well, that would be based on doing the appropriate tests. So you need to have a doctor who is looking at binocular function, accommodative function, and oculomotor dysfunction, and that exam will take more than 10 minutes. It's not simply to go in and say your eye health is appropriate and you have 20/20 vision and you do need or don't need glasses, and that's the end of the examination. If a child is having problems in school or problems with attention, and that's all you're getting, then there's no value in regards to looking at the vision therapy piece. If you're getting an assessment that looks at those components, then we're talking about looking at whether vision therapy is appropriate. Now, let's step back for something in regards to that. One of the keys in being successful in vision therapy is the child needs to be committed to the vision therapy program. So let me give you an example of that. Based on my experience, the one thing that I learned, that when it came to making recommendations for vision therapy, the most important person in the room was not the parent who would be paying for the therapy, it was the child. And so I would always ask the child whether or not they were willing to do vision therapy. And if you take the younger child in general, they will do whatever their parents want. If you take an older child, before they become a teenager, they basically have an opinion. And once they're a teenager, you can assume that they have an opinion. If they say to me that they won't do vision therapy, then I would not do vision therapy for them. Because what I found is when you take a child and you can't get them motivated to do your therapy, you are going to be unsuccessful. And if a child said to me that they do therapy, I need to prove in a period of time, and this is going to be based on the doctor. I can't speak for every doctor out there. The model that I use, I expected change in 3 months. I used to use an in-office as well as a home-based program. So we had an unwritten contract. The child had to do a minimum of 5 days a week for 30 minutes a day. And I knew from my program whether they were telling me the truth or not, because I could see a step-by-step progression. And so to just simply base it on history, the child comes in and you say, are you doing therapy? Yeah, no, I'm doing therapy. Even adults do the same thing. Have you been doing your physical therapy? Yeah, I've been doing my physical therapy. Have you really been doing your physical? Well, yeah, we know that scenario. The point is you should see results within a specific period of time. And if you're not seeing results, then you need to step back and look at the problem a little bit differently.
So let's talk about the vision therapy itself now. I like what you're saying about, look, it's 3 months. Are you willing? Of course, the answer has to be yes, or none of this is going to work, just like anything else in lifestyle changes. 5 days a week, 30 minutes a day, seems very reasonable. What's going on? What are some of these therapies that someone's going to have to do to help them to have their eyes see better?
The programs are going to vary. Again, the program that I used was fairly simplistic because I was working with students. And so it changes the dynamic to a degree. But we use different types of lenses, or what I could talk to you about flippers, where a child would read with different types of lenses. They would read a paragraph in a book. Usually you start off with one eye at a time. So you would start with the right eye. Then you would do the left eye. And you would work on what we call focusing exercises. You could do a technique where you would be looking from near to far. And then we're using different types of filters and lenses. So we've got Polaroid lenses on. And you're using different types of devices where the child is learning to coordinate those two eyes and improve their ability to increase those ranges. Or you could be using a technique where the child needs to learn how to track properly. For example, you'd have different numbers, and they need to be able to track. When a child is tracking with their head instead of their eyes, that means the system is not working properly. And so those types of exercises need to become ingrained. It's like you look at something, you present an exercise, it needs to be repeated over and over and over again until you develop automaticity. And so that system now is ingrained in the system itself. And so doctors use different techniques. There's a lot of things now that have been created on computers. There's computerized programs where kids can put on filters and actually have computerized programs in front of them that doctors have an ability to do home therapy with. That was not available to me at certain phases of the early part of my career. You have lots of different techniques where the vision therapy can be basically individualized for the child.
How does somebody, I suppose the parent, obviously they're paying for it. How does somebody go about finding an optometrist or professional that understands how to do this, to work with that person? Obviously, everybody's situation is different, but someone's going to be thinking out there, how do I locate someone that knows what they're doing?
I'll give you two organizations. One organization was called COVD, College of Vision Development, and the other, and it's changed its name to OVDRA. And if they Google it, they can find that organization, OVDRA. And if they go to that Google and they have that organization, it can identify doctors in the area that are skilled in vision therapy. And there's another organization called OEP, Optometric Extension Program. If they go and Google that, they can also find doctors who are involved with vision therapy.
We have people that are going to be listening to this literally all over the world. So obviously US, Canada, Australia, New Zealand, UK, some very big countries that watch a lot of my programs, but we are in a lot of other countries. Is this an international situation or is it limited?
No, they're both international. And again, if they can't find a doctor there, then they need to find a doctor who is interested and willing is currently doing vision therapy. They need to look at are the eyes more than the ability to see 20/20. You have to look at the philosophy. And I can't speak to what everybody does in vision therapy. Some people do it a little differently than I do or did. But again, I think that for the child or the adult that's struggling with their eyes, I think you have to go the extra step to try to find the proper intervention.
I think what's difficult as we close out, and I want you to speak to this for just a minute or two, as I listen to you explain all of this, it's just like the field of exercise and, exercise professionals saying exercise is so important, you ought to get busy doing it. It's really hard to get people into doing this. And as I listen to you, I feel like a lot of people, especially these days in the modern world, are staring only at one type of thing, mobile devices, computers, whatnot, TVs. They're staring, looking at something in such a fixed way, and yet the muscles and how much the eye can do, looking up, looking down, looking left, looking right, looking diagonally in the upper right, lower left, all of these directions that people are not using their eyes. Like you say, they're moving their head, but are they really moving their eyes and sort of getting out there and moving around with their eyes more? So many people it's like atrophy, right?
Well, that's why you're seeing this increase in myopia. Basically, staring at screens and constantly holding things extremely close, not being outdoors, not exercising, not eating properly, not sleeping properly, not understanding recovery. All of those things are affecting people's vision and health. And we need to look at it holistically. It's not the eye. I think the problem we're dealing with is what we call silos. People are living in silos. We're becoming so specialized that I said to my students at one time, I said, there's going to come a point where you're going to go see the eye doctor and he's going to say, well, you have a right eye problem. You need to go next door because he's a specialist in the left eye. Well, we're not integrating things. We need to bring these things together. Nobody has the magic tool or the magic pill to solve every problem. If a child has a problem in school, it's not going to be solved just by vision therapy. But then again, if you don't address the eye, it's not going to get solved either. So we need to expand what we see in regards to our interventions.
As we close out just for another moment, I think maybe with all of our healthcare providers tuning in, as I've spoken to you about already, medical doctors, naturopaths, doctors of osteopathic medicine, chiropractors, they're all out there. They're seeing so many people. They watch my programs, see what's going on, what I'm putting out there. Talk about what you see with our current vision care system and where you would like to see it go as we close out, please.
Well, if I look at my career and I look at what I did and I look at where we are, I would say disappointment. I would say I'm very disappointed in the fact that we have not been able to communicate to people what vision is versus sight. And let me give you the Medicare system. Medicare will pay for eye disease, but they won't pay for functional problem. Now, you think about what a patient has if they don't have their ability to see because they can't even afford a pair of glasses. That's like being blind. Now, we go and we try to prevent blindness through medical issues for diseases which are important. I will not say that that's not something we should be doing. But then again, we don't allow people to have the tools to see as part of the system. And that's disappointing. I'm disappointed in the profession. We need to look at functional problems because it's about quality of life. That's what we're talking about here. We're not talking about morbidity. Morbidity is an issue in itself. But when it comes to children, and it comes even to adults, we need to talk about function. And the fact that we use our eyes from the time we wake up in the morning till the time we go to sleep at night, and you can't determine that in a 10-minute eye exam in a small 20-foot room and assume that you're doing the patient the best in eye care.
Dr. Laudon, I don't think I need to say it, but I'll say it anyway for everybody who's listened to you very carefully for this presentation and for all your work. I really do appreciate your passion and your desire to get this information out there. Again, thank you very much for your time.
Thank you for inviting me, and hopefully I have made a difference to somebody out there.
I hope you enjoyed episode 7 of the Eye Health DocuClass and you're feeling more inspired to take better care of your vision naturally. Tomorrow's episode is one of the most important yet. We'll reveal how eye problems can signal your future risk of heart disease and how paying attention to your vision can help you to avoid a heart attack, stroke, or other life-threatening condition. And don't forget, if you'd like to own the entire eye health docu-class with all the amazing bonuses, simply click the link you see on this page and choose the package that's best for you. Talk to you soon. Take care.